So one of the things that I mentioned very briefly last time was this idea of vertical dimension. Okay. So the idea is that as we adjust the teeth, we don't want to do too much, right? If we do too much, then what's going to happen is, the upper and lower jaw is going to get closer and closer and closer to each other. So there are a few rules that we had in terms of adjusting teeth. So one of them was if you have lower anterior teeth touching the linguals of the maxillary anterior teeth, which surface did we prefer that you adjust? The lingual of the maxillary anterior teeth. And we gave a couple reasons for that. Did anybody remember the reasons that we gave? Okay, let's give one. So if two things touch each other, right, you got lingual of the maxillary and then the incisal of the mandibular, they're both functional in the sense that they both come in contact. Mackenzie. Aesthetics, right? So adjusting the lingual of the maxillary, you're hiding, what you've taken away. Nobody's going to notice that you've adjusted back there. Is that what you're going to say too? Okay. And we had one more. Anybody remember? Should have made it a quiz question. All right, I'll give this one to you for free. The idea is, remember we had you do the S's? S's? Do you guys remember doing that? Does that refresh anybody's memory why we rather adjust phonetics, right? So the idea is there's this concept of closest speaking space, right? How much distance is there between your anterior teeth when you're making those S sounds? So we've kind of trained our minds and brains to kind of make these S sounds clearly, right? So if you start hacking away the incisal edges of the lower teeth, then what you're going to do is affect that closest speaking space, right? So we want to maintain that incisal edge level. So I have this slide. Let me get back to this idea of vertical dimension. Okay. So everybody right now, just stop what you're doing. Okay. Everybody's relaxed, right? Are your teeth touching right now? No. Okay. And close your teeth together. Okay. Everybody moved a certain distance, right? So that first position that you're in, if we were to measure, if we were to put two dots on your face, just like this patient on our left, and made that measurement, we would call that the vertical dimension of rest. Right? And then close your teeth together, and it moves. About how much does that move? On average, our average patient will move 2 to 3 millimeters. So that interocclusal distance, right? The difference between vertical dimension of rest and vertical dimension of occlusion is about 2 to 3 millimeters. So this concept will come into play also when you start your complete denture course. But I wanted to kind of give you kind of a introduction to this idea because I think it can be a very confusing idea to some, but we're going to try to simplify it, right? Vertical dimension of rest. Just sit there, stare at a blank wall, okay, pretend to go to sleep. Close your teeth together. Vertical dimension occlusion. Generally closes about 2 to 3 millimeters. So, let's say we're equilibrating somebody's mouth, and we take that green stripe football, and let's say we're heavy-handed, right? And we just go to town on those teeth. What do you think is going to happen to the difference between VDR and VDO? Right? The difference is going to get bigger. Right? So we've over-adjusted their vertical dimension of occlusion, and now we would say that they've lost vertical dimension of occlusion. Right? So let's say you're really aggressive and reduce it by like 4 millimeters. So now your average patient that used to have a vertical dimension of 2 now has something like a difference of 2 now has a difference of 6. And you've completely changed the dimension there, and that can affect your muscles and also your joint. So the idea is that we want to try to preserve vertical dimension by minimizing the amount of tooth structure we're going to remove. Okay? So probably in your things I'll ask about the lecture on occlusal schemes are, these principles that we have of occlusal adjustment. One is, okay, what's the reason why we rather adjust the lingual, the maxillary for anterior teeth? And what's the problem with over-adjusting the teeth in general and start to close down vertical dimension? Any questions on that?